life sciences team. Together with our partner Polycom, we're really pleased, proud, and excited to participate and sponsor the summit. So we thank you for that opportunity. You know, I share the same views that the doctors this morning, and Microsoft, I should say, Dr. Laurie and Dr. Hale and others pointed out the need that we really have to provide higher quality care as a system to more people, all at a lower cost, right? That's the challenge facing the system, I think, in a nutshell. So how in the heck do you do that, right? One of my favorite quotes on that is by a guy named Dr. Atul Gawande. Does anybody read? No. Yeah. So Checklist Manifesto was just out recently by him. Great author, great thinker in the space. And what he said is, what we really need is pit crews, not cowboys. Right? So this speaks back to the old model of medicine where it's doctor and patient in a room. That doctor is going to know everything about that patient in his brain. Right? Between the pressures on the system, between the advancements in technology, between the specializations, the shortages, it's just not possible to go on that way. It really requires collaboration, pit crews, high-performing teams, and very collaborative processes. Right? So we really think that that's the key, and that technology can be a very important driver behind that switchover. So I've got kind of a wheel of some of those constituents in the process behind me. And I think you can break it down into three main kind of categories. One, inside health systems, right? Just how do you get that care team working together where you're really utilizing your scarce resources the best way possible, where everybody is in sync around the next step in the patient's journey, and you're not causing unnecessary delays or waste in that process, right? So that's kind of the internal side. Externally, and Dr. Dell will be touching on this, as we enter more ACO type arrangements or shared risk arrangements, there are more constituents coming into play, right? Health plans may be introducing some care managers, and then the providers are playing a role, and everybody needs to be on the same page as to, again, the next step in that patient's care to make sure that they're getting good tests, getting good appointments, whatever the case. And then I think the third dimension is really the patient itself, him or herself, right? How do you engage that person in their own care? And that could be the most important member of the pit crew, right? The driver, let's call it. But I think Deb will talk to that in terms of managing, again, rehospitalizations. How do you make sure that patient is following through on the orders that were given? Or how do you help them manage a chronic condition or multiple chronic conditions for these sickest patients? So at Microsoft, we're really looking into how do we help customers across those three areas. And you can see some of our technologies in the middle. Don't like to start off talking about product names right away, but I can give a few examples around Link itself. This is our IM and Presence and Unified Communications, so audio, video, web, conferencing tool set. And a lot of our customers own this already. So it's an example of how you can use commodity type capabilities to really make a difference in the care system. And a couple examples I'd give, we have a hospital system out east who embedded Link on top of their Epic EMR, and we're just able to surface the care team presence indicators so they could see if they're available, if they were with a patient. And they did this because they were having trouble coordinating on discharge plans, right? They had a policy about every so often we have to consult one another on this patient's planned discharge date and how they're doing against that in an effort to manage length of stay. So just by putting that in and being able to see that the other parties were available or not, and then click to chat with the other, they were able to significantly increase the compliance with that and reduce their actual versus planned length of stay from about 16% to 2%. So that's one example. Another, and this